Angharad are going to spend the next 10 to 15 minutes just talking you through a scheme that is very Wales specific. So we've gone from a very global conversation earlier with Steve, which is great to hear, back down to the basics of what's happening in Wales, which I think is important and it's pertinent, and we're really grateful to have the opportunity to share it with you. So as Lauren says, I'm Sian and I'm working very closely with Angharad. We've got a few other members of our team who are doing small pieces of work with us on this particular scheme. And I wanted to talk to you before we start. I wanted to talk to you about the fact that this scheme isn't just about medicines, it's much wider, and it picks up on many of the areas that Natalie mentioned earlier around where we know there are priorities around decarbonisation. But for the purposes of this presentation today, we focus some of our examples around the medicine-related actions within our scheme. But we would urge people to have a look at the scheme and to see what else they could do outside of the medicines agenda. Can I have the next slide, please, Angharad? Thank you. I thought we'd start today with just giving you an example of one of our practices that are working with us on this particular scheme. So this is Andrew Evans. He's a pharmacist who owns an independent pharmacy based in Newport. The pharmacy is close to two local surgeries, quite large surgeries, and is very, very close to the Royal Gwent Hospital. Next slide, please. Angharad. So the reason I've chosen Andy, of the many people who've been working with us on this scheme, is because he's done some great work around inhalers prescribing. So you will hear a lot about inhalers during today from different aspects, but I think it's really important to understand the role community pharmacy can have. And it's not just about returning inhalers, it's around medicines management. So Andy chose an action within our framework, which is what we've termed an innovation idea. And Angharad will talk through later on around some of the categories of actions. But Andy chose this one action. And then I was informed earlier in the week that Andy's actually taken on 32 actions. So this is one very small action amongst the number of actions he's done. And what he actually did in a nutshell was that he identified people who were prescribed inhalers, particularly the MDI inhalers. He had a small fund provided to him from the health board to enable this initiative to take place. He gave patients a 10-minute appointment. He called them in face-to-face and he talked to them around their use, whether they could use a greener type of inhaler. He demoed the inhaler and he took the opportunity to talk to them about some of the healthcare issues that could affect their respiratory conditions, such as whether they smoked or whether they would benefit from a vaccination such as flu. He had an arrangement with the local surgery and the local respiratory nurse, where those patients he found would be able to switch to a non-MDI inhaler, that he could feed that back to the respiratory nurse and that practice would action that change. So in a very short period of time, Andy saw 60 patients. He identified there were 300 who were coming in regularly to his pharmacy for repeat prescriptions. And approximately 50% of them were eligible to be switched just for the conversation that Andy had had, of which many of those did change with the surgery. So he calculated he saved 32 tons of carbon, which doesn't seem a lot, but when you actually calculate that, that's over 100,000 kilometres in a diesel car. Next slide, please. Thank you. But Andy didn't stop there. And I have to say, Andy didn't just do this as part of the scheme. He's been doing this work for some time. And he cited some other examples of what he's done. So he's installed solar panels on his pharmacy. He's dug up some of the pavement and rewilded it with wildflowers. He's changed his electricity supplier to a more renewable supplier. He's added loft lagging and he's calculated his carbon footprint. Where he's found that the carbon that his practice is emitting, he's now planted trees. So he claims to be one of the few or many carbon neutral pharmacies in Wales. So Andy has given us a quote around the fact that he's found this really enjoyable. He's enjoyed working with his team and he feels that this was a good thing to do. One of his top tips that came out of the work that he's done was very much around not doing this in isolation, talking to your local GP surgery and the others around you so that the patients are not bounced between one service and another. And part of the reason I chose this one to talk to you about was at the same time we were having conversations, Public Health Wales, with the Health Board Community Pharmacy Leagues and Community Pharmacy Wales around a national specification for pharmacy to take forward this type of service nationally. And I'm pleased to say that service specification is nearly there. And we've worked with Swansea Health Board in particular to get that specification to include an inhaler review and a switch, not just an asthma review, all bar the negotiations around the funding, that should be available for health boards to commission at some point this year. So, next slide, please. Of course, Andy isn't the only person that's been working with us. I'm not going to steal Angharad's thunder because she'll give you some information around the number of people who have enrolled so far onto the scheme. But we did run a pilot in January to March, and these are some of the quotes that the pilot sites have given us as part of our evaluation of the pilot sites. In particular, there was something that was really interesting around the pilot site, saying having sort of come through the awful couple of years around COVID, was really refreshing to do something different. They felt working on this agenda was very much a team effort, and it included the whole team, not just the clinicians, and that was something that this team and the non-clinical staff really valued. And I particularly like this quote in the middle where somebody had said, we don't need a few people doing it perfectly, we need millions of people doing it imperfectly. And that's the ethos on what this scheme is all about. The actions in this scheme might seem quite small, they might seem quite simple. If we can get everybody doing it in Wales, then I think collectively it'll make a huge effort. So I do believe I'm going to hand you over to Angharad now, who will give you some details around the scheme itself. And then I'm just going to come back for a few parting comments. Thank you.
Thanks, Sian. So yeah, that was a great example of how the framework has been applied in practice. So what I'm going to do now is quickly explain a little bit more about what the framework is and give some examples of actions within it. So although our case study was from a community pharmacy, this is a framework for the 4 independent primary care contractors, which means that GP practices, opticians, dental practices, and community pharmacies can all register for free. It contains a relatively short selection of practical actions organised across 7 high-level categories. Most of the actions can be accomplished by any of the 4 settings because they relate to things like procurement, waste, or buildings and estates. However, we've also included 1 contractor-specific category for each setting to take account of your unique clinical settings. For GPs and community pharmacies, there are a number of actions related to medicines use and inhalers in particular, which is why we've been working with a number of the individuals and organisations on today's call as part of our expert group. We also had support from the Welsh Government, from Natalie, professional bodies and clinicians as part of this group, and therefore in co-producing the framework with us. Where possible, most of the actions in the framework have been aligned to our key policy and legislative drivers in Wales. So things like the NHS Wales Decarbonisation Plan and the Wellbeing of Future Generations Act, to name just 2. So following a lot of developmental work and a successful piloting phase, which is where Andy from JDS Evans came in, we officially launched the framework across Wales at the beginning of June to coincide with World Environment Day. We hosted a free webinar, which if you missed it can be viewed by going to our website, and we provided the hyperlink on this slide. Whilst on our website, you'll also see 2 inspiring videos from the Minister for Health and Social Services and Minister for Climate Change, explaining why it's important to register to the framework. We were also really pleased to receive a very supportive statement from the Future Generations Commissioner, given the synergies between our work and the Act. If you are interested in registering, this is the homepage that you'll first see, which has got a registration button on the top right of the screen and then individual setting tabs on the left. This platform was developed in collaboration with a national charity called SOS UK, which stands for Students Organising for Sustainability. They're also responsible for the management and general maintenance of the site, and they run a number of similar programmes across the UK in universities and hospitals. However, we're the first Wales-only primary care scheme. Before I move on to talk about the award part of the scheme, I wanted to show a few examples of the actions that we have in the framework. So the first action that you can see here is included in the GP specific category, and it's about reviewing the proportion of DPIs and soft mist inhalers used by practice compared to MDIs, and then taking action to reduce the proportion of MDIs initiated and prescribed on repeats. The second action is included in the community pharmacy specific category, and it's related to educating patients about the carbon footprint of inhalers to promote patient-driven change. We've also included some examples here of non-clinical actions around the carbon footprint of your practice and replacing lighting. So just to highlight that the framework does contain a mixture of clinical and non-clinical actions. On the actual framework, so on the website, all the actions are accompanied by further information which signposts to different resources to support you in achieving the action, as well as information on how you'll be assessed at the end of the year. So as this is a framework and award scheme, we do have 4 levels of award associated with participation. The first level is called Working Towards, and that means that your practice is registered. You've started to do some actions, but you haven't yet reached the bronze level. From then on, each level of award corresponds with the number of actions that you've completed, and therefore the number of points that you've accumulated. So every 1 action equals 1 point. These are the thresholds that we have for 2022, and the awarding will take place later in the year in November. So just onto a couple of quick data slides now. So this line graph demonstrates the number of practices that have registered to the framework over time. So starting earlier this year when we had our 12 pilot practices, and then we can see there's a jump in early May, which was around our soft launch, and then a further increase at the beginning of June when we launched nationally. And we've set ourselves a target of reaching 100 practices to register by October. And as of this morning, I had a quick check and we were at 98. So we're doing quite well. We're nearly there, but we'd love to get past 100. So for this slide, the data was pulled almost 3 weeks ago, so it's a little out of date. But what I'm, I suppose, trying to show is that we've had practices registering across all health board areas and across all contractors. At the moment, GP practices seem to be leading the way, but there's plenty of time. So if you work in one of the other settings, or if you work in a GP practice, definitely plenty of time to sign up now. So a couple of take-home messages before I hand back over to Sian to close our presentation. So firstly, we know that the scale of the problem can seem daunting and it can be difficult to know where to start. But if we all start by taking small actions, then collectively we'll make a difference. And secondly, if you work within one of our 4 practice settings, then please do encourage your team to register. And even if you don't work directly in a practice, then you can still play your part by signposting your colleagues to this framework. Okay, so I'm going to hand back over to Sian now, please.
So just a few more slides, and it has already been mentioned today. We couldn't have picked a better day really to discuss this agenda. I've just downloaded some of these pictures from the BBC News website yesterday. So we are in the height of extreme heat conditions, and I suspect in the winter we'll be in the height of extreme winter weather conditions, be it flooding or cold. And so I just wanted to reiterate that, there is a real reason we're doing this, and people are going to suffer and people are going to be harmed as a result of it. And here's some quotes from our Deputy Chief Medical Officer earlier in the week when we were predicting this weather before it became upon us. So I just wanted to leave you with some of those sort of messages really that are coming from the fact that there's a reason we're doing it and there's a reason we're trying to do it in Wales. And so I would just reiterate in Hannah's final comments, if anybody on the call today hasn't signed up, we'd really urge you to. If you want to find out some further information before you sign up, then please have a look on the web pages, because there's plenty of information that you can find out before you're committing to do it. And if you've got any questions around the scheme itself or something you want to do locally, then please get in touch with us. And that's it from us for today. Thank you very much.